Hello, I'm Andy Reynolds, host of NCQA's Quality Matters podcast. I'm speaking today with Suzan Mora Dalen, who is the founder and CEO of QMetrics. QMetrics is a thought leadership sponsor of NCQA's 2025 Health Innovation Summit. And to learn about QMetrics' work to improve healthcare, Suzanne has been nice enough to speak with me about a broad range of quality topics. Suzanne, welcome. I appreciate your time.
Thank you. I'm so excited about today.
I'm curious about your work, your impact, and what you see coming in healthcare quality. I note that you have several decades of experience in this field, almost 20 years as a HEDIS auditor. So I know you have a lot of stories to draw upon, and I know you're looking ahead to a lot of important topics. I'd like to focus on three things: what, so what, and now what. So let's start with the what. What is Qmetrics doing to improve digital quality care or healthcare generally?
Well, we do a number of things. And specifically, I will start off with saying that a large part of my career has been HEDIS and quality reporting. I was a HEDIS auditor for 19 years. So you can probably guess that that is a big part of my love and a big part of what we do at QMetrics. So not only do we help interpret complex data, we help with advanced analytics. And then also, we are really innovative in really moving the needle in difficult populations for performance improvement. So that, in essence, is generally what we do in the quality improvement space.
And what can you tell me about your impact, or how do you know that you're improving healthcare quality?
Well, we do that in one way is that we are actually the data aggregator validators for NCQA. And so a big footprint for us is the ability to validate data and ensure that it meets the NCQA requirements for that data to be certified and to be fed back to health plans. And this is data that's derived from health information exchanges and other repositories. So that's one big area of impact. But also, I'd like to believe that through all of the hundreds of audits that we've done, that we've been able to impart not only best practices, but be able to really interpret complex specifications and really help organizations demonstrate that improvement over time.
Well, we covered the what that you're doing, the so what, or your impact. It's quite substantial. I'd like you to look ahead. Tell us, what do you see as the now what, or what do you recommend that people who care about quality know or do now to ensure sound quality in the future?
Sure, absolutely. Well, before I answer that question, I want to acknowledge that there has been a huge growth in the area of AI. We all see it. We are living it right now. It's moving very, very fast, which has been fantastic because this growth has allowed something that we really haven't seen in the past decades, and that is to analyze large sets of data. And this has huge benefits. It allows us to be able to not only analyze large data sets, but also to look at populations. And so I come from a time when it was quality improvement, quality management only, and not really population health. And so we see a lot of that change. And truly, AI is facilitating and enabling that. And from a quality measurement perspective, we've seen a lot of changes, as I indicated. And I'm going to date myself here, Andy. I started in HEDIS back in 1999, and we had about, I don't know, 50, 55 measures. Now, just about 20 years later, we have over close to 100. And of course, some of those measures have retired. There's new measures as well that range from public health to chronic illness, preventive care, cost of care, et cetera. And we've also seen changes with detailed segmentation of data, which relates to race, ethnicity, language, gender identity, et cetera, which is truly, truly valuable because it allows us to look at that data uniformly and then be able to compare apples to apples. So I'm really pleased to see those changes. That are very, very helpful for the area, for the space of quality improvement and quality management. Now, some of the things that I think that are not going well, and I'm sorry if I'm jumping ahead a little bit, but that are, I think, are challenges is that We still are collecting data manually for some of the HEDIS measures. So for all the HEDIS geeks out there, you know what those measures are. But we're soon going to be, all that data will be collected electronically, and it'll be digital. And it's the world of interoperability. And so by 2030, we're going to have all those measures that will be electronically exchanged. And so what I worry about is that with the move in the AI direction and also in digital reporting is that we're maybe not as focused on data accuracy and validation, and that piece is slowly being diluted. And so the adoption of the AI software, as great as it is for AI prompting, for natural language processing, and there's massive benefits to that. I want to be sure that we do not lose sight of kind of the human factor and ensuring that we're not only that we're not taking data at face value all the time, that we have some systems and processes in place to validate data, to look at data for its accuracy. And so as part of our experience, not only through the data aggregator validation program, but also through some of the other work that we've done, we have seen issues relating to erroneous data. So we've seen a 250-pound baby. Well, how does that happen? That happens with systems where perhaps the systems of units, metric versus imperial, are not being adhered to. We may see incorrect diagnosis or history of diagnosis that is not correct, that's being carried on to different systems because of that interoperability and exchange. So we can't abandon the concept of and the importance of data accuracy. And by data accuracy, I mean, what is the accuracy of the data as it was entered by the physician at the primary source? Data validity. Is the data valid for the scenario or the situation? We also have data reasonability. Is it reasonable, again, for that infant to be 250 pounds? Does it make sense? And so AI sometimes doesn't see that, and it's lost in the shuffle. Are there data completeness? And so is there a complete transfer of the data from one system to the next? Same thing with data verification. Were there modifications in that data transfer? If a hospital sent over a SNOMED code, is that further being translated into a different code, or like codes that are similar but maybe not exact? And sometimes, although systems can be put in place to catch these things, many instances, it's the human factor, it's the human eye, it is those processes that really facilitate and leverage quality improvement, data accuracy, data reasonability, and in a nutshell, data adequacy. And by that, I mean that is the data adequate for the source that it's coming from? Does it have the CPT codes? Does it have the up-to-date industry standard code sets that are expected to be coming from that particular data source? And so being able to understand that large data set, being able to really see a lot of the output from these AI technologies. At the Health Innovation Summit, there was a room full of AI companies who do fantastic work. What are we doing with that data once we receive it, and are we applying the data checks that are needed in order to vet that data fully? And so the other challenge that I heard at the Health Innovation Summit, and it was really interesting because there was a lot of great tables, a lot of great technology represented there that is very exciting, is I kind of kept getting the question of, well, I'm in the position to do X, Y, and Z. I have these beautiful, these reports, these colorful reports. And so what do I do with this? How do I actually utilize the data to really have some action so that it's relevant to the population that we serve? How do I evaluate that data for its credibility and ensure that what we're receiving or what we're sharing is actually accurate? And so so my fear is, again, that we are losing some of the human factor, and with that can go data integrity, and we cannot lose that in this day and age. So I hope I've answered that part of your question. I kind of was long-winded there.
No, not at all. It's clear that you have seen a lot and know a lot and have been thinking. deeply about where the industry is headed. And by the way, I don't think I've ever heard a more vivid example of poor interoperability or things that don't make sense between systems as your 250-pound baby.
Yeah.
That's a great example. Now, you mentioned you started your work in the previous century, Suzanne, late
Oh my
1990s.
gosh, did you have to do that?
Well, I'm sure, it's a pretty quantitative field. Lots of people will do the math. And by the way, I'm there with you. So no shame there. You're not alone. But you mentioned the growth of HEDIS measures, and I'm wondering how have you found organizations can best balance comprehensiveness and practicality? In other words, how have you, as a practitioner, user, auditor of HEDIS results, how have you kept that balance between the expansion of what is measured versus the practicality of using measurement?
That's a such a great question, and I don't think I have a clear answer for you, because I think that there's still room for a lot of the solutions. But from what I hear from our clients, and also being an auditor for so long and doing hundreds of audits, is increasingly organizations and folks that are charged with this responsibility of quality measurement and improvement and improving quality of care is balancing the large measurement set and meeting the regulatory compliance requirements that your state may have or the federal government may have if you have a federally funded product. And then meeting the needs of the population that you are serving. And so it is a very difficult I think it's increasingly difficult. I think even the audits that we did 20 years ago are very different than what they are now, in that we're looking at supplemental data, we do look at data accuracy, et cetera. But I think that it's going to continue to, I think, be more and more complex. I was sitting at one of the sessions at the Health Innovation Summit, and it was such a good session. There's so many terms like CQL and FIRE and ELM and DQM, and I've heard from many folks, even some auditors, where it's going so fast, and not every organization has the technological gravitas or even the staffing potentially to keep up with all the technological advances. And so there are some organizations that do have that staffing and the resources and are able to kind of keep up with it. And there's others that say, we're a small organization, we're a regional plan, we're Medicaid only, we can't keep up. So I think that I would not want to see that gap continue to widen. I think it's really important to really evaluate how fast we're going and what measures are the most meaningful. And I think that if you're a plan, that you're always balancing what you're required to do, and then also ensuring that you are utilizing data to, again, meet the needs of your population and show improvement. And that's why I mentioned race, ethnicity, language. Those are all super important. As a plan, there's always those persistent non-compliant members, right? You're like, I have this quality improvement program, I have this initiative. Why aren't the tactics and campaigns working for my population? I think AI has a piece of that and can be very, very valuable. It's how do we utilize the data? How are we smart about it? How do we not only grab onto the low hanging fruit, but also I think also being aware that there's limited resources and really selecting those measures and those areas that we want to focus on that we can actually have an impact on. So that's kind of my perspective on that.
Well, Suzanne, thank you for your time. We only have about a minute left, but I am curious about one thing. Before we started talking, you said fancy math is cool, but I'm dying to know what's the end of that statement, after everything after the math, the but. Fancy math
Absolutely.
is cool, and what?
But data accuracy and completeness are important. So don't forget that. Super, super important. And just so that you folks know, we're really geeks over here at QMetrics. My husband and I met on a HEDIS audit in 2006. We got married years later. And so he's our chief health economist, and I'm the CEO. And that's our mantra, is you need to focus on good data and accurate data.
I had no idea that NCQA was a dating service. I'm glad we could bring you together. Suzan, Mora, Dalen, thank you for your time and thank you for everything you're doing to improve healthcare quality.
Thank you so much, Andy, and thank you, NCQA.